let's build up from the conference that happened last week and perhaps take a look at some of the resolutions and recommendations that were drawn from that particular youth conference.
Well, it's a conference that was long in the making and certainly driven by the youth. We had an army of really fantastic volunteers helping build the process. So for 3 days we had over 350 youth from 47 counties, from all the walks of life, which was very important to us as well, come together and really talk about good governance, integrity, and anti-corruption as it relates to UNODC's mandate. And UNODC's mandate is on drugs and crime. And so they started with a lovely and lively plenary on the first day. On the second day, they went to work. So they were divided in different working groups addressing different aspects of the mandate, and on the last day they came again together to really showcase what they in their respective groups add in terms of needs and asks as young leaders of Kenya. So the outcome document itself is really a list of prioritization that they've gone through as it relates to education for justice, as it relates to prevention of crime, urban crime in this context. They looked at transnational crime. We talked. You just had a segment on the Marrakesh. Yes, on what are we doing about trafficking in human beings, and then we had a section dedicated to health and social development, which is the working group that we and my colleague on the health and social development program worked on. So we had about 60 young leaders that worked on that segment. We looked at, we had Nakada talk about what are the figures like, how many people use drugs in the country, what kind of drugs. Then we had Ministry of Health come and see us and say, well, these are the drug dependence treatment that we have accessible in the country. Are they tailored or not to young people? Are they tailored to the needs of women? Then we looked at prevention. The leaky roof of all response to drugs. We invest very little in drug use prevention in family settings, in school settings, in the community setting, or even in the workplace setting. So we looked at that. We looked at harm reduction. We had young people who have started their CSO to address the needs of young people who use drugs. It was our colleague George from Slum Child Foundation that came to talk to us. And then we looked at also, what does it mean to have corruption in the health sector? What kind of impact does it actually have on the life of people, young people included? It's 2/3 of the African continent, right? Yes. So we looked at, for example, what does it mean, the chronic absenteeism that we have in the health sector, people working in the private clinic when they should be in the hospital? Well, it does mean that we have less access, the queues are longer, and lives are at stake. We looked at the issue of procurement of counterfeit or poor quality medical product in the country. What kind of impact does it have? We know that in Africa, on the continent, there's 120,000 people that die every year of poor malaria medication. It's mothers and fathers that go out to buy the medication, think they're treating their children, but they're giving him nothing. And there we have children dying because of these kind of things. So the price of corruption in the world of health is counted in life, not only in dollars. But then we also looked at in the other sector. What does it mean that corruption's in other sector when it comes to funding the health response? It's money that's no longer available. So is it, we try to take cases and look, well, that's 600 doctors we could have in different counties, or nurses or social worker. So we sort of toyed around with these ideas and what it meant to them.
Okay.
And they came up with a 6-point in the declaration, in the resolution document.
Okay, I'm sure there's so much to discuss, just as you've mentioned. But let's specify and take a look at the role of good governance in healthcare. I know you've mentioned the role of corruption and how it actually inhibits the progress in terms of healthcare, not just in Kenya, but various African countries. So good governance does go hand in hand with proper healthcare.
Absolutely. I think when we look at, there's a reason it's part of the Big Four. We're serious about, really, it has an impact on the development of an entire country. And it's not an African problem, it's certainly a global problem. And that was part of their discussion as well. How can we, in our field, in our counties, have an impact? How can we, for example, when we discuss absenteeism, they started thinking, well, what are the solutions? How do we have a better time and attendance, for example, in our hospital, to make sure that when a mother goes to deliver a baby or comes with an unhealthy baby that requires support, that she doesn't wait, or that she's treated as the priority arrives, not because somebody received money in the background to jump the queue. So there are really little things oftentimes that we don't perceive as corruption, but have an impact on the development towards the 2030 development agenda. We have real targets, they're bold, they're ambitious, and certainly Kenya has made, especially in the field that is of UNODC's interest, drugs and crime, has made incredible strides. It is a leader by far in the East Africa region and in the sub-region as well, in terms of responding to the needs of people who use drugs. And we could